Results of the qualitative sister study to the one Steph has just presented, and it's going to touch on the limitations that she mentioned in the prior paper. And it was conducted by myself, Faisal, Manda Marioki, and Dr. Michael Magoha. I won't linger here for too long because my distinguished colleague has done a very good job in elucidating to you what encephalocele is. And as we already said, it's a rare neural tube defect, which we know that rare diseases are rarely studied, but this doesn't mean that we need to negate the need to get the adequate information and resources to aid these vulnerable patients and even their families. So the table that we have here is essentially an illustration of the guiding points to how we did our study. So we're trying to identify the risk factors that contribute to the development of the disease, and we wanted to assess the factors influencing the therapy and care of people who have this condition and the impact on their caregivers. So as you can see, the first half of it, the preconception period, as well as the very early weeks of the first trimester of pregnancy, here we are asking questions like, are these mothers taking their folate supplementation before pregnancy? Like, we're wondering what are the nutritional habits, we're wondering are they vaccinated against Torches viruses, which have been linked to causing congenital abnormalities. And so now as we move more towards the factors influencing the care, early on, she already mentioned that there's like a key period between the 11 to 14 weeks where it's really crucial to diagnose this condition so that this can provide a better bedrock for the kind of interventions that you're going to look at and even promote the patient prognosis. And the other things that we're concerned about are like even during pregnancy, are the mothers going for adequate ANC visits? Are they completing, let alone initiating the folate supplementation? And now going towards birth and beyond, are they getting the adequate psychosocial support? Are the families aware of programs that can enable them to better provide for their children? What's the access to neurosurgical care looking like? Are there delays to diagnosis? Are there delays to management? So those are the questions that we are asking, all with the aim of understanding what gaps need to be filled in terms of promoting the quality of life of these patients and their families, as well as prolonging the life expectancies of these children. So the methods, similar to hers, prospective cohort study, 6-year time period. So the quantitative data, the study was more focused on that, although we still did manage to capture information that was essentially congruent to what she shared, and that would be what we collected from files as well. We had a larger sample size of 49. And out of that 49, the qualitative aspect, now where we're trying to get this subjective information of what people are actually experiencing and what these families are going through, that was captured through interviews we did over the phone. We only managed to contact 15 people and get consent and that kind of information. And we're actually still doing an analysis where you pick up all the themes across all these patients. So as I said, these are preliminary results. Much can watch this space. So where are we? The psychosocial aspect, we also thought we'd throw in the PECS depression inventory to understand the mental disturbance that going through supporting a patient with this illness causes. This is the same information as Steph. Basically, the risk factor, male gender, the variant that is most likely in our setting is the occipital, and I think you should note that there's a difference with global data which says that it's more in female children. We also noticed that these patients, aside from just the herniation, wherever it is, anterior, posterior, basal, these patients can also present with other comorbidities, chiefly microcephaly, hydrocephaly, and the other ones you're seeing listed here, which would definitely impact the prognosis and even the level of care that you have to include for these patients. And She already shared a lot about the ethnic backgrounds of the patients in the Kenyatta population, Nairobi County, surrounding counties, but as far as Garissa all the way to Kisumu. And so this is really where I'd really like you to key in and listen. So we noticed that although the average age that you're seeing, it's actually supposed to be 31.4, not 29, of mothers is 31.4. Most of the mothers who had these children over the age of 35 at the time of conception. And as much as 2/3 of the participants were going for the antenatal clinics, up to the 4 times as we are taught in OBSGYN and ETC, only half of them were actually starting a folate supplementation. And of those people, only half were finishing the folate supplementation. And you know, this is a key and proven by many studies, mechanism of preventing this neurotype defects in general and encephalocele. And this could be because we discovered that only 1/3 of them even understand that it's important in the first place. There's probably a number of us here who, and even me prior to this study, didn't realize the importance of having folate prior to pregnancy, God willing. So basically, management and diagnosis, we observe that almost all of the patients are getting a late diagnosis because we already mentioned if it's beyond 14 weeks, it's late. And so, startlingly, none of them were getting it before the 14 weeks. So what are the reasons for this delayed diagnosis? What are the reasons for this delayed management? There are overlapping reasons. The typical story we're always singing, poor UHC, lack of accessibility. You know, you live far, and then when you get there, do they even have time for you? Are there enough neurosurgeons? And then even if you get them, can you afford it? And so for the psychosocial aspect, that's really what we really wanted to get out of those interviews. What we would find is that the caregivers, so this was open to mothers, fathers, whoever picked up the phone, they talk about how they'd feel like it was their fault that the child got this disease, they'd feel helpless, and this would even impact them, sleeping, eating habits, anxiety, and there's no need for caregivers and for this secondary effect on families to be happening. And so one key thing we also noticed that was impacting them mentally was the stigma that they face from healthcare workers and the community. Can you imagine a healthcare worker telling you, "Sasa mama, mbona hukunywa folate ona basi?" Or in the community, people, like a lot of the patients just tell you, "Oh, at that time I didn't want to talk to anyone." You know how people talk as witchcraft. "Oh, it's your fault. We've not seen these things, it's just you." So we really just wanted to advocate for that aspect of making such a thing, even such in forums like this, just to increase the awareness so people don't confront it with so much hostility. And also, because there are support structures that people may plug into that can help them even with the management and the diagnosis, such as the Association of the Physically Disabled of Kenya. And so, sorry, I'm really talking fast. This is the final table. It's similar to that I showed you at the start, and it's essentially a summarization of the themes and the information we've managed to pick up so far. And so, in the preconception period, what can be done? Ladies need to know that they need to take folate, better nutritional habits, and what can we also do? As my colleague said, promote ultrasound, regularize it across ANC visits. It's not that we're saying figure those children with as much radiology as much as possible. They need to be done early and by people who are able to diagnose it and won't just say, "Oh, there's a growth, it will go away." So during the pregnancy, making sure that even though they're visiting, they're getting educated on what they need to be taking, and that they're adhering to the supplementation regimen. And after birth, what we would promote or request is that for neurosurgical care to be made more. In general, surgery is seen as a very niche facility, but to expand neurosurgical infrastructure, whether it's getting more specialists and spreading them out across the country, and also promoting this knowledge amongst colleagues that they're able to even diagnose this well and expedite the management. and this is the final thing. And yeah, as we said, we also just want to avoid the secondary problem. Children are getting sick, they're getting vulnerable, they're living less, but also we don't know the secondary effect is it impacts the people who are taking care of them. And so we don't want that. And we want to overall improve the quality of life of the patients, keep babies like these, their families, and to prolong the life expectancy. So thank you so much for listening. Here are the references, and there we are. Catch you on Twitter. Okay, see you.
Mpigie makofi. Thank you so much.